Okay.
Okay, so I would like to introduce Alex from Healthwatch. Alex is going to be presenting an investigation that Healthwatch has done around COVID. He's going to be highlighting some of the findings in relation to mental health. Over to you.
Thank you, Danielle. So good morning, everybody. Welcome to our talk today. We're just going to talk about the COVID report that we've just released, and I've highlighted some specific findings about mental health that we thought would be relevant today. So I will show you the first slide. So just to give a brief introduction, I'm from Healthwatch Trafford. I'm their research and project officer, and we provide information to people that get in touch with us. We can provide advice and support about local health and care services. So some people might call us and they're looking to change GP or looking for a dentist, and we can tell them the channels that exist for them to do that. We also gather the views of local people on the way services are delivered, and we can also enter and view certain places where care is delivered. So we have in the past entered care homes, and we've got several reports on our website that talk in detail about that, speaking to residents and making recommendations. And we also follow up on the comments of people about the health service in general, and we make reports on those, and we report the odd findings as well. So we influence the way services are designed and delivered based on this evidence that we collect. We do this by having a seat on the Health and Wellbeing Board, and we also work with the CCG and Trafford Council that commission services. So we can pass information recommendations to other local Healthwatch as well, Healthwatch England, which is kind of our mother body, although we are independent of them, and we're all independent offices as well. So in GM, there's actually 10 of us, one for each area. So we can work together, sharing information where relevant, but we primarily operate for the people of Trafford. So just to summarise the report itself, it was published this month, and it takes into account the reviews of people from July to September this year. That means it covers the first lockdown and kind of up to the latest lockdown, but not during that time. So we started the survey and the work we were doing. Lockdown had been in place, and it stopped, and then there was the tier system just coming in. So we've got some of the views of people during that time. We had 250 responses to our survey, and we also spoke to a number of people through focus groups and one-on-one conversations, and we spoke to local people who are working as professionals in the area, and to get their views as well. And we conducted this through contacts that we had. So we've got a mailing list, social media. We did a leaflet drop through one of the hubs that have been set up during COVID, and so this allows us to get a wide reach into the community. And if you look at the bottom there, there's a link where you can find the full report, or you can just go to our website. So the key findings in the report: most of the people who spoke to us were women, adult women, but we do have a spread of people from different backgrounds, and those are highlighted in the report as well. One of the key findings was about access. So people have continued to access services, especially things like the GP, during the time of COVID. People were getting concerned when certain services weren't available, and I'll speak a bit about that later. So the key services that people talked about were GPs, hospital outpatients, and dentists. GPs seem to be adapting slightly better during the lockdown than the other two services mentioned there. One of the key issues with outpatients was people not knowing when their cancelled or delayed appointments would be restarting. Now they were having letters at times, but they really wanted to know more. And as we all know, things have kept changing with the second lockdown. So this means appointments are being delayed more and more. Dentistry has been an ongoing issue as well, with people maybe not being able to find routine appointments during the lockdown, and then when things started to open, it could be extremely slow to get an appointment, with routine treatment perhaps not prioritised as much. Yet this is often preventative, and people have been even calling us to tell us they can't find a dentist or they're not registered, which kind of compounds the issue at times. So in terms of the response, the switch to digital where possible has been really useful, allowing people to keep those touch points with the services they know, and at least have a line to know what's going on. But the cancellations have been of the concern to people. In terms of what's been called COVID hubs, community COVID hubs, there have been a number set up in Trafford. There was a lack of general awareness amongst the people we talked to. That might be for a variety of reasons, of which we don't have the answer, but it could be due to people not needing them or feeling supported. If they've got family and friends, they didn't have problems getting to the shops, then perhaps they wouldn't need to access these. But it was a finding that we've kind of pushed forward to say maybe you need to tell people more about what these hubs are. We also looked at information, so how people gathered information about the changes that were going on due to COVID, and we've got a list there. GP surgeries came out as one of the more trusted ways of people accessing information, so that again is a good finding. Make sure that GPs are in touch with people and sending out the right information. Television, social media, the internet, friends, family, and the council were also mentioned as key sources amongst others. In general, we had quite a good spread of findings. So the access to services, one thing we talked about, the change to caring responsibilities, family pressures, how life in general had been disrupted across the board. People had issues getting shopping in the first lockdown, but there was some sign of that improving over time as people adapted and online shops had more slots, etc. Work had been disrupted for many people working from home, and discussions about pressures, people losing their job. But there were a number of people who said that the time was positive, maybe for reflection or changing their mind about their life and things like that. So that was something that came through. And again, a few people that said they weren't affected at all. So in terms of mental health, we've extracted that for this presentation. There were a variety of effects on mental health. The majority felt that it was slightly worse over this period. Again, about a third said that they were unaffected, so that is something to note. But it had an impact from people from what we'd found. The reasons for the changes were quite complex, so we asked people to talk about what the effects had been, as well as rate how their mental health had been affected. So change to social life, work, being confined. There were comments from those shielding as well, struggling with how that had impacted them. Family not being able to be together, or family being together too much. So maybe if your school's cancelled, then children be at home, homeschooling, creating a lot of pressures in some families. So some of the key areas of experience we'll explore in more detail. So one topic that recurred was this feeling of anxiety and worry. So I've put some quotes here. So feeling that this is going to carry on and doesn't have an end, and mental health would deteriorate. That was from one lady there, and also anxiety about the lack of clarity, so not knowing what's coming, not knowing what's happening at the moment, and a whole range of things in terms of work, exercise, so the lack of freedom. So you don't know what's going on, and you find it struggle to take action to cope with it as well. As I mentioned earlier, shielding. So there's a comment here about how they were scared about being infected, and they also had their children who needed extra care. What's going on in the country in general, and the lack of health checks. So that kind of speaks to what I said earlier: appointments being cancelled, routine appointments. People weren't able to get access to these, and that caused them worry. They were scared that maybe their underlying conditions wouldn't be addressed, or changes, deterioration wouldn't be flagged up in time. There is another topic here on isolation and loneliness. So I think this had been something that was talked about before the pandemic actually, but it came up here once again. So people saying here. I'm normally very well, but mental health has been impacted by a feeling of being imprisoned and unable to do what I want. They understand here the need to keep the NHS protected, but it's having a big impact on them personally. Another comment here, lack of contact with family and friends who normally give me a boost. So support network, telephones not being replaced for face-to-face. As we all know, a lot of things are lost with using technology, even something as common as the phone. Not being able to socialise, just a simple comment there, but something that's affected many people. And feeling isolated with the new restrictions, unable to see friends and family even in the garden at times, and feeling like life is continuing but mine is on hold. So that this is specifically about someone who may be shielding. They feel like they're under extra restrictions on top of everything compared to others. And then there's a comment there about them being disabled as well. So on top of the shielding and everything, that might affect ability to return to work and such like. So stress in general was something that came up quite a lot. So people just feeling very pressured. It could be around work, it could be around school. So here, I think this one was from a young person. They've got more stress due to exam cancellation, school-related issues. Not being able to access medical services. So again, we knew this was happening before the pandemic, maybe a long wait for your GP especially, but now that's been exacerbated really by this time period in many cases. My job's become more stressful as I've had to combine it with full-time childcare. So that was a recurring theme really, and something that isn't really captured in this piece because in the new lockdown that we've just started, many schools are still open. So that should alleviate some of the pressures that were found in the first lockdown. As I mentioned earlier, people were also positive at times, so appreciate being able to keep fit and well, in tune with nature. The weather, which at the time was summer, it was better, so people were able to get outside. Improving mental health and the chance to slow down and reflect, spending time with the family. So these were some of the more positive comments we had. And specifically on young people, so I wanted to draw out some of the comments for today. So family, so people have been reported that the lockdown was particularly disruptive initially, challenging for family, so that this has an effect on young people. They'll be either at home missing out on their education. That was something that came out, not being able to see their friends, not maybe having the support that they would have otherwise. This is something that they've tried to address, so hopefully in the future would not be as big an impact. Otherwise, socializing, not being able to meet with others and close relatives. So that is the end of the presentation. I'm not sure if Danielle, you've got any specific questions, otherwise we'll leave it there.
Thank you. That was really interesting, really, really fascinating. It's nice when you've got that qualitative research where you can really get a feel for the kinds of things that are coming through and actually get those quotes in. I think it's really fascinating. It's not so different to what I would imagine, but it's nice to just kind of have it pinned down like that as well. When you were talking about that 49% of people had recognised some sort of deterioration in their mental health, it's like, wow, that's really incredible. And I think, with the other one, even though there were some people who were not necessarily saying, oh, well, there's not been too much of a shift, I think that 49% speaks volumes. And then you've got those kind of different areas that people are noticing as well around people's freedoms being taken away, isolation, anxiety of not necessarily recognising how things are going to change or what's going to happen. So, yeah, I think it really, really interesting, really interesting stuff. And I think it can be used to sort of enable people to recognise that actually this is a theme. It's not individual. It's not what people are, this is what people are experiencing as a theme for what's happening now. So yeah, thanks so much for sharing. Really, really interesting.
On our website, Alex, we've got, it's listed there, isn't it? Healthwatchtrafford.co.uk. In the resources section, we've got a link to our mental health directory. So if people do feel they need extra support at the moment, they can take a look there. We also have a separate COVID page as well. So if people want to know about local services during this time. that should help, I think. Our young volunteers are going to tackle doing a young person summary of Alex's report soon. So we'll see what they come up with.
Oh, brilliant. Oh, that's good. Yeah. So sort of youth proofing it.
Yes, exactly. Yeah. Yeah.
That's
We often find our stuff needs to get rewritten for young people.
yeah, it's important, right?
Yeah, totally. Yeah.